Jenni is, of course, a member of our graduate group in biomedical engineering. She joined my group in 2011. She completed her coursework in biomedical engineering with a perfect 4.0. And she has done exceedingly well, not only in terms of courses and research, as you will see in a little bit, but also in terms of leadership. She has been one of the most effective leaders, not only in my group, but also in the entire Department of Biomedical Engineering and in our graduate group. She has mentored students all the way from middle school, if not elementary school, all the way to first year graduate students, and she's done it exceedingly well. She's been. Is it? Okay. He doesn't want to talk about you, how great you are. No, that's a call from the garden. We got to take that one. So back to our discussion here. So one of the many exemplary things that Jenni has done here as a leader, as a student leader here, has been the organization of different programs that highlight and discuss issues of gender inequality, especially in science and in engineering. I was very proud of the fact that she created this quarter-long lecture series in which those inequalities were discussed, analyzed, and I think solutions were provided. I thought that was a spectacular program that she introduced to our department. Back to the academics, she is a member of the Designated Emphasis in Biotechnology program, and I am very glad to report the fact that she was supported by the T32 training grant in biotechnology for 2 consecutive years. That's an extremely competitive program, and those fellowships are very prestigious. And I'm delighted to see the leadership of the program sitting here among us, and we're thankful to you for your guidance and leadership in biotechnology on this campus. So before joining us here at UC Davis, Jenni did her bachelor's in bioengineering at UC Berkeley. And before that, she was in high school, in a boarding school, actually, in close to Boston. She grew up in this area, and you will hear about her research in a little bit. Talking about her research, what I'm asked her to do here today, and here now we're getting to the rules and guidelines of the presentation. She's going to give us a slide-based presentation of about 35 to 40 minutes, in which she will highlight her hypotheses and her salient results. This is her work. It's a lot of work here. She's not going to be able to present everything that's here. She's going to only talk about some of the important findings. During the presentation, I would ask the members of the audience, except the committee members, to please refrain from asking any questions. You're going to have your turn to ask questions at the end. Members of the committee, of course, please feel free to interrupt and ask questions, though very respectfully I would ask that you refrain until the end, unless these are questions of clarification. When the presentation is finished, I will turn the floor to the members of the audience for your questions. And then after you're done, then everybody will leave the room, and I will turn it over to the members of the examining committee for their questions. In talking about members of the examining committee, I'm the chair of the committee, Kyriakos Athanasiou, primary appointment in biomedical engineering, Professor Harry Reddy, primary appointment in orthopedics, Professor Lee Griffiths, primary appointment in the School of Veterinary Medicine, Professor Eduardo Silva, primary appointment in biomedical engineering, and Dr. Jerry Hugh, primary appointment in biomedical engineering. Are there any questions from the audience about what we're doing here today? I'm sure Jenni knows what we're doing here today. So let us welcome Jenni to the podium for her presentation.
being here this afternoon. I'd like to, in particular, thank my dissertation committee, Dr. Athanasio, Dr. Griffiths, Dr. Hugh, Dr. Reddy, and Dr. Silva. And today, I will share with you the culmination of my dissertation work, which is entitled Bioactive and Mechanical Stimuli for Engineering Neocartilage with Native Tissue-like Tensile Properties. This work aimed to address the very large and growing problem of osteoarthritis, which affects nearly 240 million individuals worldwide. OA, osteoarthritis, can affect any of the articulating joints as shown here in this figure. OA can be a result of general wear and tear due to age or altered loading, but it can also be a result of trauma, such as in the case of motor vehicle accidents or sports or work-related injuries. In the US alone, nearly 27 million individuals are affected by OA, and this places a nearly $130 billion burden on our healthcare system. Now, osteoarthritis is characterized by degeneration of healthy articular cartilage. Shown here at the top is normal cartilage, which is a tissue that is rich in both collagen type 2 as well as glycosaminoglycans, or GAGs, and these are produced by the resident chondrocytes within this tissue. Now, when damaged, cartilage either cannot heal or it is healed with a mechanically inferior fiber cartilage that is rich in collagen type 1 that's synthesized primarily by fibrochondrocytes as well as stem cells. Now, there are a variety of treatment methods for OA, and they range from palliative to the end-stage options like total joint replacement. Shown here are common means of biological repair. So a defect or a lesion is often debrided or cleaned up. Microfracture can then be used to promote bleeding, and this is a method by which we can bring in a source of both stem cells as well as bioactive molecules. Alternatively, chondrocytes that are isolated and expanded from the patient can be used and injected into this defect in a method called autologous chondrocyte implantation. A newer iteration of this approach uses a matrix-assisted autologous chondrocyte implantation. Now, while these methods all are commonly used in the clinic today, their long-term functionality as well as their ability to restore tissue function and structure is limited. As such, cartilage tissue engineers aim to engineer ex vivo a tissue of mechanical robustness that can be implanted into the joint and withstand that strenuous joint environment. These strategies typically begin with the selection of a cell source. These cells can be autologous or allogeneic in nature, but they must be of a lineage that is able to produce high line-like articular cartilage. These cells are then used in a scaffold-based or scaffold-free method of cartilage tissue engineering to form a neocartilage construct. These constructs can then undergo stimulation with bioactive molecules or mechanical regimens before these constructs are then implanted into the joint. Integration between the native tissue and the engineered tissue is of utmost importance to promote graft survival within the joint. Now, our lab deviates from the traditional tissue engineering paradigm using cells, scaffolds, and signals in that we employ a scaffold-free technique that we have termed self-assembly. During self-assembly, phase 1 utilizes a high density of cells that are placed into a non-adherent mold. During phase 2 of self-assembly, these cells undergo cell-cell recognition and begin to secrete an extracellular matrix that is rich in both collagen type 2 as well as proteoglycans, seen in phase 3, and this matrix matures during phase 4. Now, this process is amenable to various bioactive stimuli as well as mechanical regimens. To date, we've been able to generate neocartilages that possess compressive properties on par with those of native tissues. However, the tensile properties achieved with these neocartilages are about half those of native articular cartilage. And so, to truly engineer a biomimetic tissue for cartilage tissue engineering and for cartilage replacement, we must be able to engineer tissues that possess both the compressive and tensile strengths of those of native cartilage. As such, the objectives of this work were threefold. My first objective was to explore the cellular mechanisms by which the self-assembly process occurs. In my second objective, I sought to elucidate the role of novel bioactive stimulation regimens that were derived from either mimicking the osmotic environment or developmental processes toward enhancing the tensile properties of engineered neocartilage. Finally, I sought to apply a tensile stimulation regimen in combination with matrix remodeling factors toward engineering an articular cartilage replacement with native tissue-like properties and finally to evaluate those tensile properties in vivo. Toward these objectives, 4 specific aims were proposed. Aim 1 sought to explore the role of cadherins and integrins in mediating the self-assembly process. Aim 2 sought to investigate the effects of controlling the cellular osmotic environment and enhancing the functional properties of self-assembled reticular chondrocytes. In Aim 3, I evaluated the use of developmentally critical thyroid hormones to increase the tensile properties. And finally, Aim 4 sought to enhance the anisotropy and tensile properties of neocartilage via both a tensile mechanical stimulus as well as matrix remodeling factors, and then to explore in vivo the stability of these tensile properties. Now, while Aim 1 sought to enhance our understanding of the mechanisms by which self-assembly occurs, Aims 2, 3, and 4 sought to improve the tensile properties of these scaffold-free self-assembled neocartilages to achieve tensile properties akin to those of native cartilage. Now, in my first aim, I sought to explore the mechanisms of self-assembly, and I hypothesized first that cadherins and integrins play distinct roles in this process. Secondly, it was hypothesized that coordination of the cytoskeletal elements within the cell can promote robust self-assembly. Now, our lab has previously demonstrated that the self-assembly process mimics that of native cartilage formation during development. So during mesenchymal condensation, that typically leads to tissue formation, and cadherin is upregulated between those cells. Our lab showed that N-cadherin, shown in the red staining, is also upregulated during the self-assembling process during phase 2. Now, cadherins are adhesion molecules that form between cells, and this is distinct from integrins, which link a cell to its extracellular matrix. The function of cadherin and integrins is critically dependent on divalent cations. In the case of cadherins, calcium is needed for function, whereas magnesium is necessary for the function of integrins. The objectives of this aim were threefold. First, I sought to visualize the self-assembling process, to then determine the role of integrins and cadherins, and finally to examine the role of the cytoskeleton in mediating the self-assembling process. Towards this first objective, I used time-lapse microscopy in various conditions to visualize self-assembly. Articular chondrocytes can be self-assembled into a glass-potted petri dish shown here, and then they can be visualized overnight, and this allows us to image the self-assembly process. Now, as you can see, the cells initially begin as a single-cell suspension that is well dispersed. However, these cells rapidly cluster, and by about 4 hours, they reach a steady state of self-assembly. Now, having developed a method by which we could visualize this process, I then sought to explore the roles of integrins and cadherins by applying inhibitors that would affect their function during self-assembly. To do this, I applied 3 different culture conditions. The control is our basic chondrogenic medium that is used to culture our neocartilages when we conduct our tissue engineering studies. The EDTA and EGTA conditions here are used to chelate divalent cations, and they do them in a preferential manner. So EGTA will preferentially bind to calcium, therefore inhibiting cadherin function, whereas EDTA will chelate both calcium as well as magnesium, and therefore will inhibit both the function of integrins as well as cadherins. Now, I was interested in the possibility that the collagen that remains at the cellular surface of these primary chondrocytes could somehow impede with the self-assembling process. It could perhaps favorably promote the binding of integrins to the extracellular matrix and not allow for cadherins to function. To address this question, I employed a collagenase pretreatment regimen where these cells were first treated with collagenase to remove that surface-bound collagen, and then they were self-assembled in these various conditions. Again, time-lapse imaging and quantification was used to evaluate these conditions. Now here we can observe our control condition on the left, the EGTA and EDTA conditions on the right. And as you can appreciate from these videos, the EDTA condition, which knocks out both integrin and cadherin function, is not able to self-assemble. When we then quantify the self-assembly potential, or the self-assembly index, which is effectively a measurement of the void spaces that are remaining after the cells have clustered, we see indeed that EDTA does not facilitate self-assembly. EGTA, and the control, on the other hand, allow for self-assembly to occur. Now, for our collagenase pretreatment experiment, we have the control and collagenase treatments across the top, and then the collagenase pretreatment and self-assembly in EDTA and EGTA conditions along the bottom. And as as you can appreciate again, the EDTA condition is not able to self-assemble. Now, in contrast to the previous EGTA experiment we did, it allowed for integrin function. But here with the treatment of collagenase followed by culture in EGTA, we are knocking out both cadherin as well as integrin function. As you can see, the self-assembly potential of these cells is impacted. Indeed, when we quantify that, both EGTA and EDTA conditions do not allow for self-assembly to occur. Now, interestingly, this collagenase group, effectively removing the collagen and removing integrin's ability to facilitate self-assembly, this condition actually does allow for robust self-assembly to occur. And this indicates that in the absence of collagen, self-assembly can be mediated by cadherin binding. Now, when the extracellular proteins were examined via Western blot, we saw that with our collagenase treatment here, we were able to see a reduction in that collagen type 2 expression, indicating that the collagenase treatment does in fact work. And we see that the collagen content does not recover by about 6 hours. On the other hand, if we examine the deposition of collagen type 6, which is a pericellular collagen, which is located primarily directly around the cells, we see that indeed collagenase will reduce that expression, but it appears to begin to recover by about 6 hours. Finally, when we carry these constructs forward for to day 4, 8, or 12, we see that the collagenase pretreatment actually elicits a significant increase in the collagen production per wet weight as well as per cell within these constructs. And this suggests that that removal of collagen at the cellular surface acts as a stimulus to cause these cells to then produce more collagen. And so in summary, finally, the last objective of this aim was to apply cytoskeletal inhibitors to examine the role of the cytoskeleton in mediating the self-assembly process. 4 conditions were used to address this objective. Again, our control, and then pharmacological agents, cytoclasin B, blebistatin, and the Rho kinase or ROCK inhibitor Y27632, also called Y compound. And these drugs inhibit actin filament formation, myosin contractility, and finally that Rho kinase or ROCK. Again, these conditions were visualized as before. Very briefly, the coordination of the actin filaments and the myosin motor proteins facilitates cytoskeletal organization and cellular contractility. Shown on the right, Rho kinase or ROCK is actually an upstream mediator of myosin activity. And so the use of cytoclasin, blebistatin, and this ROCK inhibitor affects varying levels of actin myosin contractility. And so in this time-lapse imaging of these various agents, we can have a control here in the upper left, blebistatin on the right, and then the cytoclasin and Y compound in the bottom 2 panels. As you can appreciate, the cytoclasin B treatment that inhibits actin filament formation blocks the ability of these cells to self-assemble. Now, when we quantify the self-assembly index of these cells, we indeed see that cytoclasin does not facilitate robust self-assembly. Blebistatin allows self-assembly to occur to a limited extent, but it is not as robust as both control as well as the Y compound. Now, this Y compound, interestingly, actually trends very closely to the control. And it's actually expected for this to occur because the Y compound is inhibiting the Rho kinase, which is upstream of the myosin activity. And so we would expect a delay in inhibition of self-assembly, which we see occurs by about 4 hours. And so in summary, this aim determined that both cell adhesion as well as cytoskeleton elements are important for mediating self-assembly. I first used time-lapse microscopy to visualize the process and determined that self-assembly is mediated by integrin binding in the presence of collagen, cadherin binding in the absence of collagen, and that a functional actin-myosin network is important to facilitate cellular contractility. Finally, this aim demonstrated that the surface-bound collagen that remains at the cell surface can affect the self-assembly process. And this is important to note because other studies in the field that examine chondrocyte aggregation as well as cell clustering may not account for that surface-bound collagen. And so their results may be preferentially biased towards determining that integrin collagen binding mediates cell clustering and aggregation. The second aim of this work sought to investigate the effect of controlling both the cellular osmotic environment on the functional properties of self-assembled articular chondrocytes. And so I hypothesized in this aim that controlling the osmotic environment and providing an environment that mimics that of native articular cartilage would enhance the cellular function, therefore increasing the formation of neocartilage. Now, to engineer articular cartilage using primary chondrocytes, it may prove critical to match the microenvironment that they experience in vivo. It's been previously shown and observed that the in vivo microenvironment is quite different from that of what we use in standard in vitro cell culture for cartilage tissue engineering. In particular, the in vivo environment possesses an osmolarity of 450 milliosmol and a calcium concentration of about 4 millimolar. On the other hand, standard in vitro cell culture conditions use an osmolarity of 350 milliosmoles and a calcium concentration of 1.8 millimolar. Extensive studies have established these benchmarks of articular cartilage, and it helps inform the selection of agents for cartilage tissue engineering. In addition, the emerging chondrocyte channelome has received increased interest, and this is the study of the various ion channels that are resident within the cell membrane. I was specifically interested in the function of the TRPV4 channel, or the transient receptor potential vanilloid 4 channel, which is calcium permeable. This channel has recently been identified as both a mechanosensor as well as an osmosensor that can regulate the cellular response to both osmolarity as well as mechanical stimulation. Our lab has previously used a TRPV4 agonist called 4-alpha-PDD and has been used successfully to increase both the tensile stiffness, the Young's modulus, as well as the tensile strength of our neocartilages. So the objective of this aim was to determine the effect of mimicking those in vivo osmotic microenvironment conditions on enhancing the tensile properties of our tissues. And to do this, I sought to apply these osmotic agents during culture. First, an increased calcium concentration, hyperosmolarity, and finally, the calcium channel activator, 4-alpha-PDD. These three agents were used in a full factorial study design at 2 levels each. Osmolarity was applied at 350 and 450 milliosmol. 4-alpha-PDD was applied at 10 micromolar. And finally, the calcium concentration used was at our standard level of 1.8 millimolar and also at 4 millimolar, the physiologically relevant calcium concentration, also called PC. Now, these constructs, after 4 weeks, were then evaluated mechanically, histologically, and biochemically. As you can see here, when we examine the gross morphology of our constructs, we can appreciate that they are smooth and hyaline-like with no gross abnormalities. Notably, those constructs that received 4-alpha-PDD treatment resulted in significantly reduced construct size. And when we quantify those gross morphological parameters, we find that indeed 4-alpha-PDD treatment leads to a significantly reduced diameter, thickness, and wet weight. We found that 4-alpha-PDD application in culture was able to significantly increase the compressive properties of our tissues. 4-alpha-PDD as a factor can significantly increase both the compressive stiffness, or the aggregate modulus, as well as the shear modulus of our tissues. Now, interestingly, we also found that 4-alpha-PDD is able to modulate the effects of other agents. For example, hyperosmolarity use alone does not really affect the Young's modulus, or it leads to a slight decrease. However, when 4-alpha-PDD and hyperosmolarity are combined, we see a significant increase in the tensile stiffness as compared to hyperosmolarity treatment alone. And so this study thus demonstrated that the use of microenvironment modulators requires fine balance. Interactions involving 4-alpha-PDD were able to positively affect our neocartilage properties, especially in the case of the Young's modulus. Now, hyperosmolarity has been previously used in cartilage tissue engineering and has elicited positive effects, but those were not seen in these studies. And the disparity here is likely due to the type of osmotic agent used. So in this study, I used sucrose. Other studies will employ sodium chloride, and the level of osmotic pressure used is also very important. And in summary, this aim demonstrated that 4-alpha-PDD is able to most significantly enhance neocartilage properties. Aim 3 of this work sought to evaluate the use of developmentally critical thyroid hormones in enhancing the tensile properties of our neocartilages. It was hypothesized, first, that articular chondrocytes retain the ability to respond to these thyroid hormones. Secondly, that thyroid hormone stimulation could enhance the neocartilage tensile properties. And finally, that application of T3, one of these thyroid hormones, would elicit significant increases in the properties and that sequential application of PTH, another hormone, would reduce the hypertrophic response. Now, parathyroid hormones, PTH, triiodothyronine, T3, and thyroxine, T4, are hormones that are known to be critical to the development of the growth plate. Now, this cartilage is actually distinct from that of articular cartilage. The growth plate is comprised of 3 different zones: a zone of resting chondrocytes, a zone of proliferating chondrocytes, and then a zone of hypertrophic chondrocytes. Now, the gradients of PTH and T3 are finely coordinated to regulate the development of that growth plate cartilage. Specifically, PTH maintains the chondrocytes in the proliferating pool, whereas T3 will promote the transition from a proliferating chondrocyte into a hypertrophic chondrocyte. Thyroxine, or T4, is actually the main circulating form of T3, and at sites of action, it is converted to T3 by the removal of an iodine moiety. The specific mechanisms of thyroid hormone action within growth plate chondrocytes have been well established and is highly complex, but they are simplified here. PTH binding to its receptor activates cyclic AMP, which then can activate SOX9, which is a major regulatory gene of chondrocytes. SOX9, for instance, can upregulate collagen type 2, which is the major collagen found within articular cartilage. PTH, on the other hand, can also upregulate NKX 3.2, which directly translocates to the nucleus to activate SOX9. T3 binding to its receptor activates the canonical Wnt pathway. It turns on beta-catenin, which can then upregulate RUNX2, which is a major bone regulatory gene. RUNX2, for example, can turn on the expression of collagen type 10, which has been shown to be a marker of hypertrophy. Now, importantly, elements of the PTH pathway have been shown to inhibit elements of the T3 pathway. As such, it's been well established for growth plate chondrocytes that PTH and T3 activate competing pathways. However, it has not been well established whether or not this mechanism functions in articular chondrocytes. So the first objective of this aim was to determine whether articular chondrocytes could indeed respond to these thyroid hormones. I secondly sought to explore the effects of temporal hormone application in improving those neocartilage tensile properties. And finally, to investigate the sequential application of these thyroid hormones to exploit the benefits of each. Towards these first 2 objectives, I sought to apply both PTH, T3, as well as T4 during neocartilage culture. Specifically, these hormones were used at 100 nanograms per mil and applied during an early, during week 1, or a late, during week 3, period of neocartilage culture. The total culture time for these constructs is 4 weeks, and again, the neocartilage was assessed as before. When we examine the gross morphologies of these tissues, we see that, again, all samples appear normal and very much like that of neocartilage. Interestingly, T3 and T4 treatment at week 1 resulted in the densest and most uniform construct. Despite this, when we look at the tensile properties of the engineered neocartilages, we see that T3 and T4 treatment at week 1 elicits robust increases in both the tensile stiffness as well as the tensile strength of our tissues. Now, excitingly, you'll notice that the T4 treatments at week 1 for both tensile stiffness and strength are able to increase both of these properties beyond those of the control. And this indicates to us that T4 must be converted to T3 within these cells in order for them to have this kind of response over the control. Similarly, when we evaluate the collagen content within these neocartilages, we find that T3 and T4 treatment at either week 1 or week 3 is able to significantly enhance the collagen production. Now, these increases in collagen trend and reflect those of the tensile properties. And so from this study, it was found that articular chondrocytes can indeed respond to these thyroid hormones, as the inactive T4 was able to have a response or have an effect on the tensile properties over the control. The study also demonstrated that early application of these hormones stimulates more robust matrix formation as compared to late application. And finally, that T3 is able to generate a tensile strength nearly 150% higher than the control, and this is paralleled by a nearly 80% increase in the collagen content. Now, T3, we know, is still able to elicit collagen type 10 expression. As shown in the mechanistic diagram, we also know that PTH can inhibit the hypertrophic effects of T3. And And so the final objective of this aim was to investigate the sequential application of these thyroid hormones to capitalize on the benefits of each. T3 was again applied during the first week of neocartilage culture, and it was followed by PTH application during week 2, during week 3, or during weeks 2 to 4 of construct culture. They were again assayed as before. And again, we found that the neocartilages appeared hyaline-like with no growth abnormality. In particular, T3 treated group shown on the right possessed a curved morphology, and this is indicative of pre-stress in the tissue. Our lab has previously shown that this morphology with that pre-stress actually is reflective of increased properties within the tissue. Again, T3 treatment resulted in the smallest and densest constructs. Treatment with T3, as shown on the right, also significantly increases the compressive properties of our tissues, nearly 4 times that of control values. So it's important to note that native articular cartilage has a compressive stiffness ranging from 80 kilopascals to about 2 megapascals. And here with our neocartilage at about 250 to 300 kilopascals, we are well within range of native articular cartilage values. Similarly, we were excited to find that T3 again elicited increases in both the tensile stiffness as well as strength of these neocartilages. And excitingly, both the compressive properties as well as these tensile properties are not impacted with subsequent PTH application. So the addition of PTH does not negatively impact properties that we can generate using T3. Despite these exciting properties, however, we still know that T3 can elicit deposition of collagen type 10, a hypertrophic marker. As such, immunohistochemistry was used to evaluate the collagen type 10 expression within these neocartilages. Shown here on the left are the tissue controls of the growth plate cartilage, which does express collagen 10, as well as articular cartilage, which does not. And as you can see, the groups receiving no T3 treatment do not possess any brown staining, so they did not result in collagen type 10 expression. However, T3, as can be expected from the mechanism, does. But excitingly, we found that later and increasing durations of PTH application were able to reduce that hypertrophic response. And this indicates to us that use of PTH within the study is able to modulate and downregulate the hypertrophic response within these tissues. As such, this aim determined that thyroid hormones can indeed be effective agents for neocartilage tissue engineering. It demonstrated that T3 can significantly enhance the mechanical and biochemical properties of our tissues, that PTH use post-T3 application does not negatively impact those properties achieved by T3. And while T3 does induce collagen type 10 expression, we were excited to find that sequential application of PTH can downregulate that response. And finally, that sequential application of T3 and PTH can stimulate robust neocartilage formation. The final aim of this work sought to evaluate the use of a tensile stimulation regimen to enhance both the anisotropy as well as the tensile stiffness and strength of our neocartilages. And then we sought to evaluate the stability of those tensile properties in vivo. This aim hypothesized first that uniaxial tensile strain could elicit matrix remodeling and alignment to produce anisotropy. Secondly, that the combination of tensile stimulation and bioactive factors could increase the tensile properties towards those of native tissues. And finally, that the tensile properties would be maintained in vivo. Now, tensile stimulation for cartilage tissue engineering has not been extensively explored. The research in the field is limited to the flex cell system, which is shown here on the left. This system uses a monolayer of chondrocytes seated onto a flexible membrane. A vacuum system is then applied to this membrane to apply a tensile strain to those chondrocytes. And this system can be very important for evaluating the chondrocyte response to tensile strain, such as gene and protein expression. However, the system is not able to produce 3-dimensional neocartilages that would be suitable for cartilage replacement. The closest the field has gotten to engineering a 3-dimensional tissue is shown here in the system on the right. The system uses fibrochondrocytes that are embedded within a scaffold and then placed into this device to apply cyclic tensile strain. And while the system is very important for cartilage tissue engineering, there have been very limited reports about increases in tensile properties of these neocartilages. And this is likely due to the fact that